The healthcare field is a competitive and demanding field to work in. What many do not know is the fact that nurses in the healthcare field are just as important as any doctor. Hospitals thrive on nurses' training and skills to care for sick patients. Without nurses, hospitals could not run. They are the backbone of all hospital services and take a great amount of time in helping their patients. A nurse's primary goal is to make sure the patient and their families are comfortable and to nurse them back to health. However, this profession creates a great amount of stress, a hazardous work environment, and extremely long hours for many to handle. Although nurses are aware of the amount of work that is needed in the hospital, working long hours and not being able to take many breaks can cause stress in the work environment, as well as simple errors in helping patients. Nick Lapley from Nursing Management stated that the average nurse works 60 to 70 hours a week, while working 12-hour shifts most of those days. During those 12-hour shifts, the nurses are on their feet for about 11. They get very few breaks, and their lunch hours are usually only 30 minutes. Most days, there's no time for breaks. This is due to the fact that there is a large amount of work to be accomplished. A study conducted in 2004 by the Nursing Journal had nurses keep a logbook of shifts worked and errors made during a 2 to 4 week period. Nurses reported in the logbook they made 199 errors and 213 near errors during the study period. Over half of these errors were drug administration to patients. And this is medical errors from 2007, and 78% is from a too rushed and busy environment, while 56% is medication errors. And this chart over here is from also 2007 with medication errors and comparing to other nations or countries, while the U.S. is among the highest with 32% and Germany is only at 16%. Now, moving on to, while nurses are on the clock, other duties that they partake in during their shift include turning beds every 2 to 3 hours, taking phone calls for emergencies, assisting the doctor, cleaning up after people, or doing necessary paperwork on a patient. I had an interview with Stephanie Hawkins, who is an LPN at Community Hospital North in Indianapolis, and she said, well, if the doctors are busy, nurses are usually doing better work, giving pages, doing things for the hospital, and or hooking patients up to a monitor, their blood pressure, heart rate, duties, 12 hours, and effective. However, performing daily, nurses may and working fatigued and shifts can with nursing when working long, it becomes an irritable, the stress level patients, the blood 12 hours, maybe, but due to it as well, and near the end of their shift, nurse pressure no longer affects concentrate as they wanted the shift when their nurses first started. The Massachusetts nurse, which is a shifting journal, started. Nurses become physically burned out from doing long shifts, and nearly 89% of the RNs have quit the healthcare field due to being burned out and having high patient loads. Due to this, the amount of stress and heavy workload is obviously causing nurses to quit the profession. So why exactly do nurses have to work all these long hours? It all boils down to the nursing shortage, which has resulted in a further deterioration of nursing work environments. Having a safe work environment is extremely important, and because of the shortage, many hospitals and nurses are being affected. The Online Journal of Nursing Issues says, another reason for the nursing shortage is there's not enough enrollment in colleges for nursing students. And while we see nurses all the time in doctors' offices and hospitals, there's simply not enough nurses to go around for all patients that need to be taken care of. Laura Marquez, who's a reporter for ABC, reported a story a while back about a lady named Shirley Keck, and last year Shirley Keck was in the hospital and she was having trouble breathing. Doctors diagnosed her with pneumonia, and for hours her daughter watched her mother suffer from pneumonia and tried to get help from the nurses. However, there wasn't any help, and it turns out that she was misdiagnosed and was actually suffering from a heart attack. And the nurse who was supposed to be taking care of her was overburdened and was allegedly caring for 20 patients, which was more than the hospital's own guidelines, and the nurse didn't have time to observe Shirley until she had to be resuscitated. However, Shirley did end up surviving, but the hospital was sued. So that just goes to show that the nursing shortage is a huge factor. Nurses are extremely important in the healthcare field, and without having nurses treat patients, hospitals and doctors' offices could not run properly. They are the backbone of all hospitals. Without them, doctors could not do nearly as much as they need to. Nurses do work long hours, but many don't always seem to mind. They just want to help their patients. However, putting the patient and their own health at risk doesn't always seem very smart. So just remember, the next time you're at a hospital or a doctor's office, try not to get all irritable and uneasy if things aren't going your way. The nurse is doing their best to make you happy and get you healthy again. So be nice, because they are probably having a hard day too.